Hey folks, I'm going to show you how to enter patient death in the QC in the OBERD system. Entering a death is a two-step process that involves deactivating a patient and also withdrawing a patient from the registry. So there's a third optional step where if the patient sustained a complication that led to the death, you have to enter that also into the actual registry data collection system. But we'll start with the simplest scenario, and that's say if you notice a patient died 1 to 2 years after the hernia operation, you can enter that death, and we'll talk about what's involved with that. So again, it's a two-step process that involves deactivation and then withdrawing the patient. So here you see the typical OBERD patient list, and we're going to focus on this patient here, CCF test patient. These are all fake patients here. And then the first thing I'm going to do is I'm going to go over to this actions drop down here and then go to edit account. And then this will show the familiar registry enrollment file entry dialog here. And so for example, I know that this patient died a couple of years after their operation. So I'm going to click that they're now deactivated. It's going to give me a little pop-up here. I'm going to confirm that. Then I'll scroll down and it'll give you a couple of options. You'll see this is a little bit expanded out. You can see date of death, and I'll enter that here. We'll say it's today. And then here you can just say the cause of death if you know it. And then once you're done with that, scroll all the way down and then click on Save Patient. So once that's done, the second step, you go back to the find the patient dialog here. We're going to go back and find our patient list. And then here is our patient. Now, the next step I'm going to do is I'm going to withdraw this patient from the registry. So instead of going to this actions drop down here, I'm going to go to this little icon here that says withdraw patient from registry. Click on that, and it gives you the warning to either say withdraw or remove. You don't want to remove the patient because that'll remove all the patient information in the QC that we entered in the OBERD system. We simply just want to withdraw the patient. You select the reason here. You say the patient had died, and then you confirm that selection. So with that, the two-step process has been completed where the patient has been deactivated, then the patient has also been withdrawn. The other scenario I'm going to tell you about is entering the death, say, from a postoperative complication. You'll follow that two-step process, but before that, you're going to enter information into the QC that indicates some of the clinical details of the complication and why the patient died. So we're going to take this patient here, again, a sample patient, and we'll open up the drop down that allows you to complete all these forms here. And now I'm going to select the 30-day follow-up form. Let's just assume this patient died from some postoperative complication. So we'll say that the patient was discharged a couple of weeks ago. Date of 30-day follow-up is today. Patient was not seen in these scenarios here, was not readmitted. The recurrence assessment method was clinical. The patient underwent a ventral hernia operation. There was no recurrence. Did not undergo a reoperation. Did not have a wound complication, but we will say yes, the patient had other complications. Say that the patient had a pulmonary embolus and then sustained a stroke, also developed sepsis and septic shock, had a myocardial infarction and cardiac arrest requiring CPR. And then what I'm going to indicate down here is that the patient did die in this clinical form here. So the patient died, and then after that, I'm going to click on next. And then it'll ask you the opioid prescriptions. And of course, since the patient died postoperatively, all of these will be no. And then, of course, the patient didn't have a chance to undergo postoperative physical therapy and did not return any kind of activity level. So with that, we've entered the third step if the patient sustained a postoperative complication. Remember that if the patient did sustain a postoperative complication related to that to a death, that should be entered first. Otherwise, if you deactivate the patient and withdraw the patient, you won't have the ability to enter that information. So just to summarize, in general, entering a death into the QC via OBERD is a two-step process that involves deactivation of a patient and then withdrawing a patient. If the patient died in the perioperative period or it was related to the hernia operation, go ahead and enter either the 30-day follow-up form or the surgeon long-term follow-up form and the pertinent information. Be sure to enter that the patient died in the clinical follow-up information for the registry first. Thank you.